Good evening, everyone, and welcome to Trillium Health's World AIDS Day 2020 program, presented by Gilead Sciences. I am your MC for the evening, Mrs. Kasha Davis, and I am so excited to get started. We have an amazing show lined up for you. World AIDS Day is an opportunity worldwide to unite the fight against the epidemic, to show support for people living with HIV, and to commemorate those who have passed. Starting in 1988, World AIDS Day was actually the first ever global health day to be recognized. So tonight, it's all about raising awareness around the HIV/AIDS epidemic, sharing stories of Trillium Health's past, present, and future, and showing our solidarity with the millions of people living with HIV worldwide. You'll be hearing from Trillium Health's innovation team, the president and CEO, Andrea DeMeo, and their staff physician and co-founder, Dr. Bill Valente. And as a special sneak peek, we will be sharing with you a portion of Dr. Valente's brand new play, Unfinished Business, unseen yet by the public. So, we're very excited to share this all with you tonight. Also, at any point during the program, please consider making a donation to Trillium Health to support their work around the HIV epidemic. You can just text the number at the bottom of your screen to get started. Every dollar is so meaningful and helpful for our community members to access the care they deserve. So now, I am honored to introduce to you Dr. Bill Valente, an icon who has dedicated his career to ending the HIV epidemic. Dr. Valente has earned his reputation as a medical maverick and pioneer in HIV treatment, prevention, research, and policy. Welcome, Dr. Valente.
Thank you, Mrs. Davis. We are so happy to have you on our show tonight. Good evening, everyone. I'm Dr. Bill Valente. Here I am, co-founder and staff physician at Trillium Health. On World AIDS Day, we focus on working together towards an HIV-free generation. Trillium Health is committed to ending the HIV epidemic. This will happen when the total number of new infections falls below the number of deaths. In order to get there, we have three goals. Identify people with HIV who are undiagnosed, that's more HIV testing. Retain those people in healthcare, healthcare is the operative word here, and provide access to PrEP, a once-a-day pill to prevent HIV for high-risk people, keep them negative. Tonight we're going to take a look back at our HIV journey. I'm honored to introduce to you a reading from a new play written by David Henderson and based on my book. The play is called Unfinished Business. Thank you all for watching, and I hope you enjoy the show.
June 5th, 1981. I remember it well. It was the day the CDC published its first report of 5 cases of pneumocystis pneumonia in gay men in New York and LA. The cases were reported by Dr. Mike Gottlieb at UCLA. He was a resident at Strong several years before. I called him to see what was up. At the end of his call, he said, "I'm not sure what's going on, but if I were you, I'd get ready." 6 months later, we had our first AIDS case.
I'm Sid Metzger, and I was a social worker in 1982 at Strong when I met Bill. A young man with AIDS was admitted to the gynecology floor where I was working. It was the last bed in the hospital. The staff didn't know what to do, and I didn't know enough to ease their minds. It was all so new. I looked up Bill in the hospital directory and I asked him to come to the floor and meet with the staff. It worked. When Community Health Network opened in 1989, Carol Williams, their nurse, called and said that they needed a social worker. I started right away. I'm thinking that I would stay maybe a year or two. 12 years later, I retired. Now, I get to watch all these beautiful people and their work from above.
Jesse was the first person we knew who got sick quickly and died. His was the first of the funerals. He was the owner of Friars, which was a very popular gay bar downtown, and it was put together by friends for friends because his family couldn't deal with it at all. And for the next 10 years, that's what we did. If it was your friend, you were part of the group that planned the funeral. And if you weren't part of the inner circle, you went, you know, whether you knew the person well or not.
I used to play in basketball tournaments during the summer, and I would always buy me a new pair of white sneakers at the beginning of the season. As my friends started to pass, I would write their initials on my sneakers. So I started in the first tournament, I think it was in late April. The last tournament was Labor Day weekend. And this kid walked up to me and said, "Wow, where'd you get those cool black Air Jordans?" And I looked down and I didn't realize it, but my sneakers actually did look black. That's how many people passed that summer.
Steve and I had talked about our own ideas of HIV care since the day we met. Let's just say our approach to treatment was unconventional. We both realized that if we wanted to do HIV care our way, it would need to be done outside the hospital and in the community. By the time Community Health Network opened in July 1989, almost 25,000 people in the US had died of AIDS. CHN was poised to be on the forefront of the AIDS effort. We had a mission to provide one-stop shopping HIV care. Medical care, pharmacy, mental health, social work, drug treatment, and a lot of home care. It was a team effort. Volunteers, residents, doctors, Steve Scheibel, Carol Williams, Ann Zettelmeyer-Greep, Sid Metzger. Doctors Chuck Cavallero and Rodney Voisine did extended rotations with us. It was a treatment team to be reckoned with. Dr. Ann Greep diagnosed the first case of AIDS dementia. So many patients who became friends, and friends who became patients.
She wasn't scared. She was fearless. She was always on the street, got the people. She would walk up and down Clinton Avenue, Joseph Avenue, Jefferson Avenue. This white woman, she wrote a list of street language, because she was bringing the people on the street to the clinic, and the clinic staff didn't know what the hell her people were talking about, where it's like works and junk and gear. And she was like, really? I'll never forget it. I remember the phone conversation. She called Steve and told them he had to learn a lingo. They all worked really hard to get that place up. The CHN clinic, it was a passion. It was a love. They wanted to save the people. They really did.
Welcome, welcome to the Community Health Network. I am Steve. Pardon our dust, we are still, this used to be the bowling alley at the Elks Club here in the Wedge, so it's a little...
It smells.
Ma, it's fine. She's more nervous than I am.
Hi, my name is Dr. Scheibel. Steve. You can call me Steve.
Sure, this is a doctor's office.
I promise, if it wasn't safe, we wouldn't be doing it.
Take it easy on them, huh? You didn't have to come.
I had to make sure you'd go through with it.
We are here to help. What can I do?
Where's Dr. Bill?
He's caught up at the hospital. He should be here shortly. I'm Steve Scheibel, Bill's partner.
His partner?
His business partner, Ma. Can we just wait for Dr. Bill?
Not a problem at all. This really is our first Tuesday night clinic, so no magazines or anything, or a water fountain. Oh, I hope this isn't Carol. Hello?
Are you sure this is a doctor's office? Because well, the man is wearing combat boots. That can't be very clean.
They're not going to let me back in here if you don't stop.
What? Can a mother express concerns for the handsome young doctor wearing combat boots who's treating my son?
Dr. Bill is not so butch. He's more of a daddy type.
You listen to yourself?
You started it.
Man, we were unconventional, for sure. Most days we worked on the fly. There was something new popping up every single day, and we had to treat it. There were no drugs, so we had to make our own cocktails. Interferon injections were hard on this patient. It made him sick. So we put the interferon in communion wafers that would dissolve in his mouth. Where'd you get those? Bill asked me. I told him, I have a friend who's a priest. Bill just rolled his eyes at me. Then this patient got pneumocystis pneumonia and couldn't breathe on his own, and he wanted us to pull the ventilator. Bill wanted to treat him with steroids, and I was all for it, but it's risky. Steroids can suppress the immune system, but the only other option was dying. And well, that's not. Carol promised him that if he was better after the weekend on the steroids, that she would pull the ventilator. Steroids worked. He lived for another year and went back to work. That was the hospital. Bill should be back in a few minutes.
What are you hiding from Carol? You said you hoped it wasn't Carol.
She just doesn't know that we have our night clinic here. She makes sure we follow all the rules. Keeps us out of jail.
Oh, I don't know. I think you'd fit right in.
Ma!
And you would fit right in with the moms. They're a support group for mothers whose sons have HIV. They're a bunch of very strong women who lean on each other in hard times. And they laugh a lot, too.
You keep my son from dying, and I'll do anything you want.
Trillium Health is the region's go-to source for PrEP. One pill a day can reduce the risk of HIV by up to 99%. Go to protectwithprep.com to learn more.
Women account for 1 in 5 new HIV cases. Get tested and protect yourself with PrEP. It's not just for men. Learn more at trilliumpillowtalk.org.
Welcome back to Trillium Health's World AIDS Day 2020 program, presented by Gilead Sciences. I am your MC for the night, Mrs. Kasha Davis from Fairport, New York, where life is fair. We hope you've enjoyed our show so far, and we thank you for being with us tonight. And boy, how about that, interpretation of Dr. Valente? Sans wiggery. I had a hoot and a holler, and I can't wait to see the finished product. Now, if you like what you've seen, we encourage you to make a gift to Trillium Health to support their work in the community to end the HIV epidemic by texting the number at the bottom of your screen. Every dollar helps us eliminate barriers to care for those who need it most. Finances should never be an obstacle, and everyone should have access to health care, regardless of their income or any other factor. Our Rochester community can count on Trillium Health to provide all with extraordinary care, always. Up next, our second segment of Dr. Valente's Never Seen Before play, Unfinished Business. We'll continue on the HIV/AIDS journey. Sit back, relax. You get to wear sweatpants. I'm in a corset and tights. Enjoy the show.
So I'm an RN. I'm an RN because of my husband. We were together over 2 decades, and in that time together, I met enough of his patients that said, had it not been for this man, I would be dead. I was working in .coms, and Steve was working out of his house in San Francisco with Dr. Brad Saget after they left Rochester. The kitchen clinic, treating patients with drug cocktails, drawing blood over the kitchen table. They had a lab in the bedroom for research samples. They presented their data at the International AIDS Conference, showing that the cocktails worked, and even had a guest shot on 60 Minutes. Of course, Steve was ahead of his time, and no one believed their data. So fast forward to today. Yeah, I'm the Vice President of Specialty Services at Borrego Health in Palm Springs, California. That's Steve's doing.
AIDS, the first time I can really remember having discussions about it was in my freshman year of high school, 2005 maybe. Basically, we spent a lot of time talking about it, and I wish it was longer. I remember kind of really getting into it, and now here I am, working at Trillium Health.
So it was in 2010. I remember I was in the HIV clinic in Erie County Medical Center in Buffalo. That's where I did my residency. And the HIV clinic is in the basement. So you walk down this long corridor, and the only thing down there is the HIV clinic. Yeah. It was the first PrEP study. I had it in my hands. The first study on preventing HIV medically. And I was like, this is like a game changer. I remember that because we never talked about prevention like this before. And this is in a pill format. I remember that. So little wins are a big thing.
The future of HIV and AIDS? Well, I can tell you top of mind that I've challenged Bill and our executive team. We have all the passion and history to be a world-class healthcare provider of HIV prevention and treatment. You know there will be new drugs, new interventions, new research. We've done a lot of work on ending the epidemic. So let's raise the bar to be the model for other organizations and communities. And we won't let COVID-19 stop us either. We will do both.
Do you hear that?
I hear something.
I know.
I don't know it.
You've never heard it.
It's beautiful. That sound, what is it? It's on the tip of my tongue.
A silence that has never been more beautiful. A silence free of death and full of life. Is it screaming in your ear like mine? It is screaming at you. You are the last one, and now the war is over.
No more HIV?
impossible.
All things are possible.
Protect yourself from HIV right from your couch with PrEP at home. Connect with Trillium Health through a video visit and get PrEP delivered to your door. Learn more at protectwithprep.com.
Trillium Health not only offers convenient on-site pharmacies, we also can deliver medication right to your door at no extra charge. Make the Trillium Pharmacy your pharmacy.
Welcome back, and thank you all for tuning in to Trillium Health's special World AIDS Day 2020 event. Every time I say 2020, I feel like Barbara Walters. And tonight's event is presented by Gilead Sciences. I'm your MC for the evening, Mrs. Kasha Davis. And now, I am thrilled to reintroduce our man of the hour, Dr. Bill Valente. To those that know him, Dr. Valente is much more than the co-founder and staff physician at Trillium Health, but a doctor who has committed his life's work to ending the HIV epidemic. Throughout his career, Dr. Valente and his team took great risks in order to advance treatment and save countless lives. His strong will to push boundaries and help others has made a significant impact on HIV treatment as we know it today. And now, I give you Trillium Health's Dr. Bill Valente.
I'm back, and thank you for tuning in with us tonight. I hope you enjoyed the preview of Unfinished Business, and that you'll come see it when we can do it live. We've come a long way since 1989. When we opened Community Health Network, we had 75 patients on the first day. A year later, we had 400. There were no treatments for the virus then, and we had no real guidelines. Here's opening day, December 1989. Louise Slaughter, our late Congresswoman, said, "This clinic will change the face of AIDS in ways we cannot imagine today." And she was right. We often made up the rules as we went along. We used unconventional combinations of available drugs to treat patients, to give them a chance to survive. Dr. Steve Scheibel, the chemist, led the way. HIV care today is a very different story. After ending the epidemic, the next target is getting to zero. No new infections, no deaths due to AIDS, and no stigma. Today, we focus on innovative outreach strategies to reach people at risk for HIV. A patient told me, today, smartphone apps are the only way to meet people. So, we're on Grindr, Scruff, and Jacked, to name a few. We give people information that's relevant and understandable and try and get them into health care. We do virtual visits for PrEP at home. We need to remember, we're trying to end the HIV epidemic during a pandemic. A respiratory virus changes everything, and we know that.
You can now access several Trillium Health services from the comfort and privacy of home. From starting PrEP to getting HIV and STD tests, Trillium at Home has you covered. Learn more at trilliumhealth.org.
Don't be shy. We've already seen it. Trillium can help you with all your sexual health needs, even from the comfort of home. We offer video visits and at-home testing kits. Call Trillium at 585-545-7200. Again, call Trillium at 585-545-7200.
Good evening, everyone, and pass that popcorn. And thank you for tuning in with us as we commemorate World AIDS Day 2020 with Trillium Health. I am your MC for the night, Lady Gaga. No, it's still me, Mrs. Gotcha Davis. Before we begin our final segment, we want to extend our heartfelt thanks to everyone here with us tonight. Trillium Health's work cannot continue without your support and kindness. If you haven't yet, please consider a donation to Trillium Health by texting the number on your screen. Every gift makes a difference in the lives of our community members who need it most. Our friends in the Trillium Health Innovation Team have been so courteous to share with you their experiences as they relate to ending the HIV epidemic. I am delighted to introduce Jonathan Jordan, Testing Coordinator at the MoCA Center, Javon Cooper, Community Health Specialist at the MoCA Center, and Brian Bartlett, HIPS Coordinator.
I specialize in sexual health, especially sexual health of LGBTQ people of color, especially our younger demographic of people of color, LGBTQ folks. Trillium Health in MoCA Rochester, we help combat HIV by our legacy, which is getting folks, providing care for folks that are living with HIV, which means getting them to an undetectable status, which then means that they cannot pass HIV on sexually. Also, we connect people to PrEP, which is daily medication that can prevent folks from contracting HIV. We also have 24/7 PEP services, so post-exposure, which means that folks who find themselves in an emergency situation are able to get medication that can prevent their exposure from becoming an infection.
The MoCA Center is a resource center for LGBTQ people of color. Historically, Black communities have always had a challenge with accessing healthcare services. So when you look at people who are at the intersection of African American and queer and poor or working class, it exacerbates their access or their lack of access to healthcare, which then intensifies sort of the social disparities that they experience.
My experiences with Trillium, I think an awesome thing about Trillium Health is that we've been at the forefront for HIV/AIDS care and sexual health care for a very long time, for decades now. And considering my position with an HIV diagnosis, I was in the proper, if not the perfect hands for my needs and my care. It's been nothing but stellar. I've had no issues, no complaints. I've felt welcome, included. I felt never judged in my own HIV diagnosis. And it's been an excellent experience being in the care of Trillium Health as an HIV patient. My experience with HIV is a little bit different from a few other people. I was sexually assaulted at age 21 about 10 years ago. From assault, I had acquired an HIV status. And I think something that's really important to focus on that is through this diagnosis, there were also a lot of other aspects, not just the diagnosis, that were pretty traumatizing and impactful. There was a lot of depression. There was a lot of weight gain. I dropped out of school twice, disassociated from my family and friends. It was a very difficult part of my life. Following my diagnosis and finally getting myself on treatment, it's been an upswing since then. Been undetectable since treatment, have been much more open and connected with my family and friends once again, took control of my health and my life and my career path and focuses. And I think being very open and candid about my own HIV diagnosis has helped a lot. I'm currently one of 30 people in the state of New York are part of the HIV Stops With Me campaign for 2020. And so my face is plastered on billboards and on commercials talking about my own diagnosis and experiences. There's still not a lot of education and understanding of sexual health, particularly in HIV. I can't say that you will have the same experiences and support at a place like Trillium Health that you would get somewhere like a lot of other hospitals or other medical centers. Trillium Health, prior to being Trillium, was AIDS Rochester. Since the 1980s, there's been a focus and a commitment to ending the epidemic, to studying the virus, to looking for vaccines, for helping out people living with HIV and having them live long and healthy lives. And it's a bar none situation. There's no other, this is the best option. It hands down is based solely on our experiences alone and based solely on the level of care and love that you're going to receive from someone that understands what you're dealing with and is there to help you through the way.
Trillium Health and the Mocha Center proudly serve LGBTQ people of color. We offer free STD and HIV testing, education and prevention, and support services. Learn more at mochacenter.org.
Get your friends and go get tested for HIV and STDs, and you could get rewarded. To see if you're eligible to earn a gift card, call 585-545-7180. Again, the number is 585-545-7180.
Folks, welcome back for the last time to Trillium Health's World AIDS Day program, presented by Gilead Sciences. I have been your host, the Statue of Liberty. No, it's still me, Mrs. Kasha Davis. We're so very grateful for each one of you who has tuned in with us tonight. Trillium Health's work to provide equitable care for all could not happen without the wonderful support of Rochester's community. To close out the evening, I am honored to introduce to you Trillium Health's President and CEO, Andrea DeMeo. We hope you've enjoyed our show tonight.
Thank you all for tuning in with us tonight, and a heartfelt thank you to all of our sponsors and those of you whose generous support helps us to continue to deliver world-class HIV prevention and treatment services. World AIDS Day is an important day for us to take pause, to remember those we have lost to HIV/AIDS, our friends, our colleagues, and family members, and to also acknowledge the progress we have made in the prevention and the spread of HIV and in the care and treatment and improving the quality of life of people living with HIV. I wish to thank our dedicated, talented, and compassionate team at Trillium Health who work hard each and every day to enrich and save lives. There's still so much work to be done to eradicate HIV in our lifetime, and your support this evening helps us move closer to the finish line. Thank you.
Thank you, Andrea, and to our generous sponsors and our audience. Thank you for being a part of this evening. We never would have come this far without your support. Community support means everything. I remember those first cases of AIDS reported in 1981. It was a desperate time. Most people with AIDS faced a certain death. And there was very little leadership from the president at the time. President Reagan never mentioned AIDS during his whole term. The good news, my friend, none other than Dr. Tony Fauci, was working behind the scenes. He established an HIV research network that exists today and is working on COVID. Nice work, Tony. But I don't want to get political here either. Our patients became our friends became our patients. It was an intense experience and it blurred the boundaries. We've come a long way since then, but the work isn't over. As for getting to zero, this will keep the next generation busy for a very long time. And I'd like to see us eliminate HIV transmission with an effective vaccine, and that will come. In the meantime, the work continues. For our work to continue, we need your help. Tonight, please consider making a gift to Trillium Health. Every dollar counts and can make a difference in our patients' lives. Our community is stronger with everyone's support, and we hope that you'll join us in the fight against HIV and eradicating it in our lifetimes. Thank you for tuning in with us, and good night.